So warts are a huge burden, very common in young kids to develop warts, especially on the hands and the feet. They're a really pesky thing. They're caused by a virus. It's just a skin virus, so it doesn't hurt us in any other way. But because it's caused by a virus, one wart quickly becomes several warts as the virus spreads. There are numerous over-the-counter wart medicines that are available that you can purchase at your local grocery store or on Amazon. Do they work? My answer would be sometimes. Sometimes they can work. I typically recommend an over-the-counter salicylic acid product with duct tape on top, and I recommend doing it every night at bedtime. But I will say, as a pediatric dermatologist, a lot of the patients I see have tried the over-the-counter stuff and they weren't effective enough. And so they come to see somebody like me, and then I talk to them about some other options. There's a fantastic prescription topical medicine for warts that works like a dream. And so most of the kiddos I see, I talk to them about that. But I think if you're just at home and you notice that your kiddo has a wart, it can be worthwhile to try the over-the-counters first. There are a lot of over-the-counter wart products. Most of them contain salicylic acid, and most of them contain anywhere from 15 to 30% salicylic acid. If you're going to treat a wart with a salicylic acid product, definitely buy something that's meant for warts. Salicylic acid is also commonly found in over-the-counter acne medicines, but the percentage of salicylic acid in those products is much, much less, typically around 2% or even 1% strength. Ringworm, otherwise known as Tinea, is something that I see almost every day in my pediatric dermatology practice. As they say, fungus is among us, and so some of us end up with a fungal rash. And fungus can pop up with a rash anywhere. We all know that athlete's foot is fungus, jock itch is fungus, but you can get fungus anywhere. You can get it on your scalp, you can get it on your arm, you can get it on your face. It can happen anywhere. Most kids pick up fungus from another kid. It could be something that they contract during sports. Wrestlers in particular are quite prone to fungal infections. All that skin-on-skin contact can sometimes lead to that. Another source for fungal infections is from a family pet. This could be a cat or a dog. We also see a lot of fungal infections from little critters like hamsters, guinea pigs, pet rats. And it's important to identify that if your pet is the culprit, because of course we want to make sure the pet gets treated. Otherwise, the pet will just keep passing it back to you. Some forms of ringworm can be treated with topical antifungals, including even over-the-counter antifungals. Over-the-counter antifungals work well for things like athlete's foot or jock itch. But sometimes these cases of ringworm become much more significant, particularly if the ringworm has been misdiagnosed and treated with a topical steroid. Topical steroids are like food for fungus, and they make it worse, and they drive the fungus down deeper into the skin. So a lot of times if I see a patient with a fungal rash and they've been treated with a topical steroid, we end up having to treat the fungus with an oral medication. We have medicines that are pills and medicines that are liquids, and they're very, very effective at treating it. Also, if your ringworm is on your scalp or your face, you have to use an oral medication to treat it. In those locations, the fungus likes to dive deep into your follicles, so topical medicines don't work. So if the fungal rash is on the scalp or face, we have to use one of our oral medications to treat it. So a lot of people ask me, especially as their kiddos are approaching kind of puberty time or teenage time, when do we need to start thinking about good skincare? And I think that's a little bit variable. I think in general, if a kiddo or a preteen is starting to notice a little bit of acne, then that's definitely the time to get into a good skincare routine. We recommend washing your face a couple times a day, morning and night. It's also a good idea to wash your face after sports or exercise, so I always remind my patients of that. And it's important to use just like a gentle skin cleanser, something like a Cetaphil or a CeraVe, nothing too harsh or too irritating. And a lot of brands also make a non-drying face cleansing wipe, which can be a very convenient way to get a young child into a good skincare routine, simply because it's so easy. Cold sores are something I see pretty commonly, including in the pediatric patient population. And a lot of people get nervous when they come in because their child has a cold sore, or they get nervous when I break the news that it's a cold sore, because there can be a bit of a stigma attached to cold sores. What I tell my patients and their families is that most of us get exposed to the cold sore virus when we're babies and toddlers, people playing kissy face with us. And if you check antibodies in adults, the overwhelming majority of us have antibodies to the cold sore virus. But it's just that some people get them and some people don't. So it's not that your child was exposed and nobody else was. It's that this virus is just very prevalent. We tend to get exposed at a young age, and some of us are just a little bit unlucky and end up with cold sores. But we have fantastic treatment for cold sores that can either be given as needed when flare-ups occur, or if people are getting a lot of frequent episodes, we can even treat with a medicine that somebody takes all the time to prevent the cold sores. So don't panic if your child has been diagnosed with cold sores. It'll be okay. And most of us have been exposed to this virus in some way, shape, or form. If you happen to have a cold sore, if your child has a cold sore, you want to make sure that you're practicing basic hygiene. You wouldn't want to touch or pick at the cold sore and then touch another part of your body or touch one of your friends or family members. Try to keep your germs to yourself. And so we discourage people from kind of picking and messing with them simply to avoid spreading the virus. The most effective remedies for cold sores tend to be prescription, and we have several options. One of them is available in a liquid formulation, so we use that for our younger kids, and then we have a couple that are available as pills, and we even have one that's kind of a dissolvable mucosal tablet that you put on your gum. So we have lots of different options, but they are all prescription. I know a lot of people will use over-the-counter Abreva and things like that. I haven't personally found those to be super effective, but again, my perception is likely skewed. Patients that are doing wonderful with Abreva don't come to see me. The patients that Abreva didn't work for, those are the people who come to see me. So perhaps my perception is a bit skewed. Nail polish can be so fun, especially for little girls who want to dress up their nails with something pretty. But a lot of people ask me, is nail polish safe for kids? I would say overall, yes. I think nail polishes these days are quite safe. The one thing you might want to do is just periodically take a break from the polish. Sometimes if you end up using nail polish all the time, constantly, it can cause a little bit of a discoloration to the nail. And then once that happens, you kind of have to wait for the nail to grow out before it looks normal again. So I would just take breaks from nail polish, but I think nail polish is okay for kids to use.